standard of living that is unrivaled in the world, only because of the labor movement. So, quickly, let me just share with you the conditions in which we work in South LA. There is clearly a health and human rights crisis in South Los Angeles. More than 1.5 million people live there. It has the worst population health status in the state of California. More than 41% of the population lives below the federal poverty level. 79% of children live below poverty. 48% of residents have no health insurance. 40% of all births are to teen mothers. 39% of all children live in long-term foster care. We have the highest rates of lead poisoning. 22% of adults have diabetes. And 80% of the housing in South Los Angeles is slum housing. It's classified as substandard. Now, these conditions are not health disparities. They are health and human rights violations. Every human being has a fundamental right to health. Let me give you an example of the health of South LA in the context of the global healthcare situation. The infant mortality rate in South Los Angeles is nearly double that of Cuba. The average life expectancy is 68 years old, the same as North Korea, and 10 years below the US national average. 22% of adults have diabetes compared to 10% of adults in South Africa. And 10% of children are besieged with asthma compared to 5% of children in Zimbabwe. So let me say again, this is the richest country ever known on the planet in the history of humankind. These conditions are not health disparities. They are violations of health and human rights. So given these conditions, how can we impact? What can we do? So we tried to develop this in South Los Angeles. We built a partnership with labor, and we began to build and establish the first annual South Los Angeles Health and Human Rights Conference on June 5th, 2009. If you look at that picture, there was over 750 people in that room who came out for that event. It was elected officials, academics, labor, international guests, activists, and hundreds of residents from South Los Angeles. Out of the conference, we developed the Declaration of Health and Human Rights, which many of you were given today. It established through a series of meetings convened with thousands of residents throughout South Los Angeles, a Declaration of Health and Human Rights, which has established the fundamental right to health, the right to behavioral health, the right to education and living wage employment, the right to education, the right to housing and a safe environment, the right to food and food sovereignty, and the right to dignity and safety. And the Declaration ended with the following statement: Resolved, therefore be it resolved, that everyone who lives or works in South Los Angeles shall enjoy all the rights set forth in this declaration without any exception. And be it resolved that we who live, work, and pray in South Los Angeles call upon our government, civic leaders, and community organizations to adopt and ratify the South Los Angeles Declaration of Health and Human Rights. And be it further resolved that each signatory to this declaration recognizes the indivisibility of human rights, pledges to oppose any legislation, campaign process, or action that infringes on the basic rights of human beings in South Los Angeles and beyond, to support such actions that promote these rights, and to actively participate in the design, implementation, monitoring, evaluation, and enforcement of policies and programs that advance health and human rights. So I want to invite all of you to join us at the second annual conference, which is on International Human Rights Day on December 10th, 2010 at the Los Angeles Convention Center. And I want to ask that we start to work together to figure out how we can come together to build a labor community alliance for social justice. We brought the UN Special Rapporteur on the right to health to South Los Angeles, and he met with leaders of labor, and he met with leaders of Martin Luther King Hospital, which, as you know, had been closed down. And he asked us to submit a complaint that the budget cuts that were initiated by Governor Schwarzenegger, that the closing of Martin Luther King Hospital, that the rollback of wages and benefits for healthcare workers were violations of the right to health.